So my name is Grace, I'm a junior doctor, so I'm going to talk to you about the day in life of a doctor. So I thought I'd start off in a similar kind of way of showing you and talking about my path to medicine. So obviously in school, I focused quite a lot on sciences. I really liked science. I always found medicine and the human body fascinating, how it all works together. Why does your heart beat? How does your brain know what it's thinking? How does it turn kind of like looking at a TV screen? How do you understand what that image is? So I always thought that humans were something I was interested in, and I knew I wanted to do a science degree. I felt that mixing science with people and talking to people and having a lot of variety was the best thing for me. So I applied to medical school. So I went to university. For medical school, well, for any medical career, you have to go to medical school and do your medical degree. And that degree is medicine and surgery, so qualifies you for both. And then you kind of pick later on which one you want to do. So I did my degree. I went to Oxford University, but there are loads of brilliant medical schools. And then this is me. I popped out at the end, graduated, and became a doctor. So I thought I would talk through a typical day in my life. So I am a junior doctor. I'm a medical doctor, so I chose to do medicine rather than surgery. But both are brilliant pathways, and you do similar training to start with in both of those streams, and then you start to specialise as you kind of get a bit further up. So as a junior doctor, this is my normal day. So I normally arrive to the ward just a little bit before 9 o'clock. I look through all of the notes from people who've been unwell overnight or new patients that arrived on the ward, and make a kind of a list of jobs so we know exactly who we've got to go through and who we need to see. In the morning on medical jobs or across medicine, we have ward rounds. So that is a group of people that follow around kind of the lead doctor of the day. That's normally a consultant, and that's kind of head of the team. They have done all of their training and they're specialists in a certain area of medicine or surgery. We see all of the patients and see how they're getting on, review all of their investigations, see if treatments are working, and then decide if we're going to change anything, if they have changed, if they're ready to be discharged, if we need to talk to a different medical team. As a junior, I'm kind of documenting as I go and writing that, but sometimes the lead consultant might not be around, so you'll see the patients on your own and you go and say hello and see how they're getting on. Once you finish that, you then make a list of all the jobs you need to do, and you basically learn to prioritise and go through doing the most urgent jobs first, and then working through the jobs the rest of the day. So it's my afternoon, so lunch, very important. Always have lunch and always go to the toilet whenever you get a chance. That's the best thing to learn from medical school. And then you start going through your jobs. So my jobs, there are loads of different jobs you can do as a junior in the day. So I might talk to families. That's become a bit more of kind of talking over the phone rather than talking face to face with COVID and having to manage social distancing and that sort of thing. I talk to different specialties. So at the minute I work in infectious disease, but I might want to talk to the breast surgeon team or neurology about a patient. I can send some blood tests off a patient, do ECGs, do chest x-rays. And then if somebody feels more unwell in the day or wants to chat to a doctor, then I'll go and say hello to them as well. Then a typical day in medicine will normally finish about 5 o'clock. There is always an on-call team. So as a doctor, you do work all hours of the day, not all of the time, but most of the time there's always someone on call covering. And so if you're on a normal day, at about 5 o'clock, you will go and find an on-call team, have a chat to them about any of the jobs that are left. Make sure they know about any patients you're worried about, they're a bit unwell, and hand over to make sure that there's kind of continuity and the patients don't notice that the doctors are changing their shifts. So if I'm on call, I will work from about 5 o'clock to 10 o'clock. There are lots of junior doctors over the hospital, but I'll have a certain number of wards, so I might cover 6 or 7 wards on my own in the evening or overnight, whereas in the day you're just on one ward in particular. Going around, looking at unwell patients, having a chat. And then again, when it gets about 10 o'clock, a different team will take over, and it's a nighttime team, and you do the same thing. You pass over any jobs that haven't been done yet, and you have a chat and let them know about any patients that are unwell that you're worried about. This is me, and I'm very proud of my coordination of tinsels and scrubs here. This was me working Christmas Day last year, so you do have to work quite a lot of hours as a doctor. That's one of the kind of challenges to think about. But having said that, it is the most fun job, and there's nothing else that I would do. So these are some of the jobs that I would do in a day. So I would have a look at ECGs. This is looking at how the heart conducts electrical activity. Changes in those squiggly lines often mean that something's going wrong with the heart, so there's a problem with the blood supply. I might I'm a medical doctor, but I could have been a surgical doctor. And if I was a surgical doctor, I would be in my scrubs and I'd be operating. I might do operations in the afternoon. As a medical doctor, I do a lot of prescribing, where I think about different drugs, different medications, and whether those would be useful for my patients, and then checking there are no side effects and they don't have any reactions to them. I might do some chest x-rays, see if I can see anything, if they're coughing, they feel a bit breathless. It's a lot of working out and problem solving in medicine. But at the end of the day, their patients in the middle are the most important people. So we work with them to make sure that they feel better in their daily life. So medicine is a very varied career. Like lots of people have said, the degree, so you do a medical degree in medical school. Degrees are recognised kind of over the world. If you've got a medical degree, that kind of allows you to work in any country. You do have to do specific exams for some countries. So America and Canada, Australia often need you to sit another type of exam just to check that the kind of pathways that you think about and know about are the same as the ones that they use in their countries, because they will differ a little bit. Medicine gives you a chance to travel. So as a medical student, I got to go and work in Australia for a few months, which was amazing. You can work all over the UK if there's a particular area, and different areas have different specialties. So in London, there's a lot of acute hospitals that do very niche things. Some of the kind of hospitals in, say, the Highlands of Scotland are very much focused on community care and managing with fewer resources. There was loads of different scope, and there's lots of transferable skills within medicine. So you have to like science and understand science. You have to like talking to people. There's a lot of communication skills. You have to love working with teams. Medicine is not just about being a doctor. The doctors work with all the brilliant nurses and physiotherapists and occupational therapists. It's a whole team that look after all of these patients. So a lot of my day is spent chatting to lots of different people to make sure that I've asked all the questions and understand what would be best for my patients. And then within medicine, there are lots of different jobs. So although I'm a medical doctor and I like infectious disease, there are huge numbers of jobs that you can pick. Once you finish your medical school, you start as a foundation doctor. And so you rotate through lots of different specialties in medicine and surgery. And then you start to kind of specialize and narrow as you go through your training. And it takes about 8 years before you get to consultant. And that's the top level of doctor, and before you kind of reach your specialty in your area. But you keep learning throughout medicine. You never stop. You always need to know what's happening, how things are changing. You always get new degrees, new diseases coming up like COVID. So we had to do a lot of learning again, because that's not something I was ever taught, but you have to learn to manage it. And then the other thing to think about is within medicine, although it's very clinical and you can do a lot of work in hospitals, you can work in GPs, you can do a bit more variety. So you can say hospital clubs, sports clubs rather, often need a doctor on the team. Often in travel, there's often a doctor. If there's a doctor on a cruise ship, that sort of thing, there's always a doctor around. And then you can also do a lot of science within medicine. So you can do some academic blocks and do some research alongside your kind of ward jobs and clinical work. So in my degree, I did a year of research. I did a research project because I knew science was something that I liked and found enjoyable. So I wanted to make sure I had a bit of science going through my medical career as well. So I still do a bit of research alongside my jobs at the minute. So these are just some of the benefits and challenges that I thought about. So one of the main benefits of medicine is that you work as a team. You're never on your own. There's always somebody you can ask, whether that's another doctor, someone more senior than you, one of the nurses, anybody at all. There's always someone around to help, and there is always someone at the end of the phone that you can ring. No day is ever the same. Every day when I rock up, I don't really know what's going to happen and what's going to change, and I like the excitement of that. And there's a lot of different jobs you have to do. So like I said, you get to talk to members of the public. If you work in A&E, you might get to fix some fractures, stitch up some foreheads if someone's fallen over. If you work in gerontology, which is old age medicine, you might help people with memory tests and check they haven't had a stroke or that sort of thing. You get to do a lot of practical skills like taking bloods, learning to put in chest drains, and you do a lot of communicating. So you talk to people and patients, you talk to their families, and you talk to lots of different doctors and specialists. The challenges of medicine, it can be very busy. Sometimes you do leave a little bit late. That's getting a bit better, but it is something that you tend to be pretty busy throughout the day as you keep going. There is a lot of work during the day, and obviously it has unsocial hours linked to it initially when you're a junior. So you work nights, you work weekends, not all the time, but you are on the rota. Obviously, certain pathways like GPs have slightly less night work, but they do a lot of work in the day. Medical specialties tend to do a bit more on weekends and nights, just because in hospitals you always need to make sure there's several doctors around. And then obviously medical degrees are at least 5 years, so sometimes people think it's a bit of a longer training pathway. But my advice would be, if medicine is something that you like and you're interested in, those 5 years go really quickly, and it is a very enjoyable and rewarding job at the end of the day.